Next bill we have for consideration is House File 1785. This will be laid over for possible inclusion in the Human Services Finance Bill. So I'm going to move House File 1785 so it's before us. It looks like Representative Noor, I see that you have an A1 amendment. Would you like to move your amendment to get the bill in the shape you would like it?
Yes, Madam Chair.
Can you just describe quickly the A1 amendment?
The A1 amendment changes the amount that was originally set in this bill from last year. So we've seen the increase. The numbers have jumped up to 34,000. When we started discussing about this bill, we had only 26,000 participants or households who are receiving MFIP, and now it's up to 34,000. So that's the number that changed. We're also changing the dates from 2021 to 2022. And finally, we are removing diversionary work program because most of the folks who are under that program were moved into the MFIP, and it also addresses those who are currently receiving rather than any future recipient for that one-time only program.
Okay. Representative Noor moves the A1 amendment to House File 1785. Please unmute yourself. This is a voice vote. All those in favor of the A1 amendment, please say aye.
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 Any opposed? Okay, the motion prevails and House File 1785 is amended. So Representative Noor, to your bill.
Thank you, Madam Chair and members. This is something that is overdue. Members, we are helping the most needy individuals in our society. When we talk about Minnesota Family Investment Program, we're talking about children. We're talking about kids who are living in poverty. Quite frankly, we want to be able to support all families that no one lives in poverty. But because of the COVID-19 pandemic, we have seen how that it has devastated families in need. We know that this one-time only $500 payment to MFIP participants will really help those individuals. This is not about taking something away or robbing Peter to pay Paul. In fact, it's paying Peter for the dues that are in that program. Quite frankly, these resources are meant to support those individuals who are under this program. Really addresses the core values of how we're going to be tackling COVID-19 pandemic. We have seen the need. I know many people say they've got enough resources, they don't need anything. Can you imagine? Can you imagine living in a poverty? Can you imagine young children who need that extra help that they cannot find? Can you imagine folks who are unable to pay their rent when the amount that they have isn't sufficient enough, even with other federal programs that they are eligible, because some of this process, by the time they spend everything, and when help is on the way, we're too late. Quite frankly, we are too late in providing that support to so many families as they've struggled with kids at home, feeding them every single day. We're talking about almost 34,000 households. More than 80,000 are young children, and especially children under the age of 6. We want to support those families who are unable to receive any benefits from their employers. We want to support families who've been impacted by COVID-19. This is a program that will help. And quite frankly, this is also support for our economy to help individuals to spend that money immediately. As we know, based on the facts and analysis, when you allow individuals from low-income families to receive any benefits or cash assistance, they're going to spend it. And if we're really, truly going to be helping families, it's the families that are in need. And I'm asking for your support. I know I do have some individuals who wanted to testify on this bill. I think we can do it. And the only expense under this bill is $31,000 for the computer systems to be able to process this one-time only 500 payment to MFIP recipients. Thank you, Madam Chair, and I ask for your support.
Thank you, Representative Noor. I'm not seeing any testifiers listed. You mentioned you have testifiers?
Madam Chair, I see Ms. Webster. I don't know if she wanted to testify on this bill.
Okay, Ms. Webster, welcome to the committee. Please state your name for the record and proceed with your testimony.
Thank you, Madam Chair, members. My name is Jessica Webster. I'm a staff attorney with the Legal Services Advocacy Project. We also refer to that as Legal Aid. And I'm just here to briefly speak in strong support of this bill. And we have supported this emergency payment since last spring and the multiple times that it's come up. And I think just the only brief point I want to make, because I've been hearing from legislators, well, there's stimulus payments and they haven't lost anything. And, you know, the reality for the families that are accessing the Minnesota Family Investment Program is that they likely lost work right before the pandemic, and they lost it in the same industries that were the hardest hit by the pandemic. So if you ask DEED or DHS for the work histories of these families, it's hotel, restaurant, retail, low-wage in-home healthcare. And so if you lost work in the fall up until January, February, and March, you would not be eligible for unemployment insurance or for pandemic unemployment insurance. And so families that were enrolled in the Minnesota Family Investment Program that just lost work, they lost out on thousands and thousands and thousands of dollars in safety net for unemployed workers. We took care of workers in a really important way that lost work during the pandemic. But these families who had lost work just before the pandemic, we turned our backs on them and we said, well, they're getting $632 a month, which doesn't cover a fair market rent anywhere in the state. And so these families have I just submitted a letter to the governor. I was joined by organizations statewide that represented the faith community, community action agencies, food shelves, Children's Defense Fund. We have seen the desperation that these families are showing and the desperation in not being able to meet basic needs. And we are feeling that desperation, even though others may not be feeling that desperation. And so this $500, or if it's $750 in the governor's budget, it's for basic needs, it's for rent, it's for children's clothes. And we think it's really important, and the TANF dollars are there to make that investment. So thank you very much for your support, and always to Representative Noor for the leadership he's taken on this issue.
Thank you, Ms. Webster, for that testimony. Are there any questions from members? Representative Albright.
Thank you, Madam Chair. Representative Noor, TANF pays for, the earned income tax credit, child care assistance, and a number of other benefits. I do note that this fund currently has a structural deficit. And although, we experienced reduced expenditures in it in recent months, that has only improved its outlook marginally. I'm wondering if you could speak to the effect that pulling 17 million more out of this would do to the reserves and the prognosis for the TANF account going forward.
Representative Noor.
Madam Chair and Representative Albright, I think we need to look into the reserve account. We're talking about the TANF reserve account. This is after we have already allocated some of the programs. And quite frankly, I think the estimate was from last year, we had almost $100 million in that account. And to spend it for these purposes is not going to diminish what is in the account. I don't foresee any structural deficit based on spending $17 million for that purpose. In fact, there are other programs that we are planning to be spending that resources that were brought forward to us. So I would like to ask the non-partisan staff to just inform us about that account so that we really understand what we're talking about when we talk about the reserve account. Madam Chair, if you'll allow.
I think Mr. Berg is with us. Mr. Berg.
Madam Chair and members, I was just...
Please state your name and affiliation, okay. And then do you need us to restate the question? Let us know.
No, Madam Chair, I'm Doug Berg. I'm the fiscal analyst for the Human Services Committee. I was just trying to look online very quickly at the February TANF fund statement, and the fund itself, I'm not looking at the governor's recommendations, but the way the fund stands now, there is not a structural deficit in the fund. If you go out to the last year in it is fiscal year 2025, we get the same block grant every year. It is $259,826,000. Projected uses in that year are 206,000. And in looking back, no year, but from 2018 to 2025, our projected uses greater than the, well, no, I should actually, excuse me 1 minute. They get, the last thing I was going to say is not quite. There is, including transfers for childcare, at the end of the period, the structural deficit is, there's a balance of $553,000 in the last year. There are structural deficits in years 22 through 24 that use up some of the balance. In the last year in 25, there's a structural balance currently in the fund and a bottom line balance of $80 million.
Thank you, Mr. Berg. Representative Albright.
Thank you, Madam Chair. Representative Noor, we've heard a lot of proposals relevant to assisting the working poor that are out of work. Just an op-ed, and I certainly know that you'll have a comment in response, but my response to a number of these programs, while they're important to discuss, I think the better way for people to realize a better situation in their life is if we were availing them to get back to work by opening up the economy in a safe manner. I think that we should be focused as much on that perspective in this committee and understanding those ramifications as opposed to one-time checks for the benefit of those. If they could work, I think they would be actually in a better position long-term as opposed to a one-time benefit. Thank you.
Thank you, Representative Albright. Even for those people who work, their wages are so low, they may need assistance, and not just food assistance, but cash assistance as well, or childcare assistance. Representative Pinto.
Thank you, Madam Chair. And yeah, I guess just in the follow leading up from that interchange with Representative Albright, I'm thinking about the shelter operated at my church in past years that I volunteer at, where we'd have two parents going off to their jobs, even as they're living and experiencing homelessness. So families are really, really struggling. I just wanted to make a comment, I guess in my capacity as the Early Childhood Committee Chair, just to note the really important child development implications in this proposal, and just how critical it is when families are living right on the edge. It's so challenging for families, but recognizing that has an impact on all the rest of us in the years going forward at the rate that young kids are developing. An additional payment and support right now to a family can absolutely tip over and provide support. And so I really appreciate Representative Noor, you advancing this. And I think it's we should think of it as a child development opportunity as much as anything else. And related to that too, building on Representative Albright's point, I'll just note if we want families to be working, we need to provide the support for them to be able to do so. I'm thinking about childcare as being a part of that, but certainly this sort of piece as well, it's you're really not going to be in position to be able to work and be able to get on a ladder to get your family to self-sufficiency, sometimes without just a small bit of help. And so I'm really grateful that this is advancing. Thank you, Madam Chair.
Thank you, Representative Pinto, for highlighting those important pieces. I'm not seeing any more questions from members. Representative Noor, closing comments on your bill.
Thank you, Madam Chair, and members for the engagement and also understanding the need for us to support individuals who are in need, specifically helping them to become more self-sufficient. And truly, this is a program that we can start helping them so they can move on and find employment and to be able to get back to work. but the immediate need is something I think we need to be looking into. Representative Albright, I look forward to working with you on some of other programs that I'm working on to address the use of these resources to support self-sufficiency for families and get them back to work. With that, I ask for your support. Thank you, Madam Chair.
Thank you, Representative Noor. So House File 1785 as amended will be laid over for possible inclusion in our Human Services Finance Bill.